taking your child to an event like a birthday party that's supposed to be happy and fun, and then there's a complete meltdown? Me too. And there are ways to improve this. We'll talk about this. Good morning, and thank you for joining today's session of Connecting Our Community. The goal of this series is to connect the special needs community with valuable resources. We do this on the fourth Wednesday of every month from 11:45 a.m. to 12:30 p.m. Eastern Time. My name is Christine Brookins, and for those of you who know me, you know that as both a parent and a professional, I am passionate about serving the disability community. Each month, we speak with experts in fields relevant to the disability community. Last month, we learned about Tourette syndrome, and I am always open to suggestions for any topics about which you would like to learn. Today, we are speaking with Elizabeth Hughes, the Pennsylvania Regional Director of the Language and Behavior Center. Since 2012, Elizabeth has worked with children on language acquisition, decreasing maladaptive behaviors, social skill groups, and vocational training. She earned her bachelor's degree in psychology from Coastal Carolina University and a master's in applied behavior analysis from Ball State University. Elizabeth is credentialed as a board-certified behavior analyst and is licensed to provide services in Maryland, Pennsylvania, and Virginia. Elizabeth, thank you so much for joining us today.
Thank you so much for having me.
I'm thrilled that we can have this conversation. And before we go forward, there's one more thing that was not in your bio that I would like our audience to know. So the first day that I met Elizabeth, she shared a story with me, and she was going down a career path that she thought was going to be ideal for her. But she experienced something that was kind of this is the way we've always done it, as opposed to this is the best thing for the child. And it bothered her. It bothered her so much that she made a shift, and that put her on the path for what she does today. And I think that actually led to her passion for it. So I just want people to know that Elizabeth is somebody who's really dedicated to the work she does. So let's start, Elizabeth. Can you tell us about the Language and Behavior Center and what it does?
Yeah, absolutely. So the Language and Behavior Center, we provide developmental support for children and families. We utilize applied behavior analysis, especially in Pennsylvania. That is our main focus. In some of our other regions, we also provide speech therapy, social skills groups, and occupational therapy. And then in Pennsylvania, we also provide general behavior consult and sleep consultation. And we try to provide support for the children and the families that we work with in all of the settings that they are in.
Those are all such really important things. I do just want to comment that the sleep sounds like a unique focus. Can you speak to that a little bit?
Yeah, absolutely. So often when we think about sleep, we don't necessarily think like sleep and behavior, but it's something that we learn as very young children. We learn the relationship between sleep and how it makes our bodies feel, and we're reinforced by those sleep patterns. But so often parents really struggle with sleep components for their children, and that sleep and that quality and quantity of sleep can often impact behavior and behavior trends that we're seeing as well during the day. So we do offer that support for families, how to, kind of support them with that in their day-to-day.
That's awesome, because you're right. We don't think about that consciously, about how the quality or quantity of sleep is impacting, I guess, the next day or days after.
Yeah,
so let's talk about who would be good candidates for the services offered through TLBC. Who do you serve?
Yeah, absolutely. So we typically support children who are ages 2 to 18 who have a behavioral health diagnosis. So this can be anything from, autism, ADHD, certain types of anxiety disorders, ODD, any different behavioral health diagnosis is something that would be categorized for these services in Pennsylvania. Most of the children that we service at TLBC are between the ages of 2 and 12. We do a lot of play-based therapy and supporting through play and taking that very developmentally appropriate approach of learning through play. And so those are kind of the age ranges that we often see. A lot of our children are children who have recently been diagnosed with a behavioral health disorder, or are struggling in a social setting and looking for that extra intensive support at that time. In PA, as I mentioned, the services covered under intensive behavioral health services do require a diagnosis of a behavioral health disorder. So oftentimes, people are referred through their PCP to a developmental psychologist or another professional for that initial evaluation process. And then the recommendations for our services come from that diagnostic evaluation or that psychologist evaluation.
Okay, so it seems clear that you have to have the evaluation to receive a diagnosis that would then lead to services. But if I'm a caregiver of a child, what's going to be my first clue or maybe the last straw that would have them turning to those doctors?
Yeah, absolutely. So oftentimes with toddlers, we see a really, really wide range of ages that we hit certain developmental milestones or see, different heightened behaviors at different ages. You hear about like terrible twos, terrible threes. So it can be hard to decipher, is this something that is within normal ranges? Is this something that, I would want to pursue an evaluation? But oftentimes, kind of taking note of those patterns in developmental milestones, patterns in transitions and lack of flexibility, coping with different changes, increases in patterns or magnitude of behaviors might also be something that leads a parent to say, I'm not really sure about this. This is something that, I think I want to explore further or discuss with my pediatrician. Oftentimes pediatricians are going to kind of note which things are falling out of the typical range, and be able to identify, like, this is something we want to keep an eye on. This is something we want to evaluate now. This is something that we want to have, some less intensive support with first, maybe through early intervention or the intermediate unit, and then go from there. So there's a couple of different ways, that a parent might say, like, okay, I'm wanting some support. Oftentimes when we come in for initial assessments, I speak to parents about, what are things that you're doing right now to avoid meltdowns. The parents that we work with are the experts of their children. So we're experts in behavior, but they are the experts of their child, and nobody knows a child like the parent who is with them so frequently. So oftentimes, as parents, we're great about seeing, like, oh, if I do this thing, my kid is not going to like that. So they're kind of avoiding those situations or experiences because the meltdowns have gotten to a point where they are so heightened that it's just not, worth being in that situation. So that's a lot of times things that we talk about as well. And those would be things that are helpful to bring up with your pediatrician or a developmental psychologist.
And it does make me think back to my original question about the example of a birthday party.
Yeah.
So I would imagine, and I know that I've lived this myself in our family, but if other peers of your child's age are participating in birthday parties and finding it to be an enjoyable experience, and you're avoiding every birthday party because of what you anticipate, that sounds like one of those red flags that they would need to contact you, right?
Yeah, I would say absolutely in that situation, and what we're talking about too is kind of that like pattern of it, right? So we know that every 3, 4, 5-year-old can have a day where like something is just too much.
Right.
That's kind of the nature of being 3, 4, and 5 is that they're still learning to cope with the world. There's a lot that's going on. But if you're seeing a pattern of that, you're seeing that frequently you're having to avoid things because of behaviors that are this bigger magnitude, or you're seeing that your child is having a hard time communicating their wants and needs and getting really frustrated about that, that might be a time where it's good to touch base with a medical professional and kind of go down that route of evaluation.
And I imagine you work with a lot of different professionals, but if someone is hearing this and thinking that sounds like my kid, can they come to you for a referral to who would do that evaluation and diagnosis?
Yeah, absolutely. So we do not do the evaluations and diagnosis in-house here, but we absolutely are connected with several professionals in the area, as well as different resources and supports that we could kind of steer parents in the right direction. There are also a number of supports coordinators and caseworkers in the area, both in Allegheny and Washington counties, which are the two counties that we service, that we can, connect the parents to based on their individual needs. And also the PCPs often have a good feel for, which evaluators are maybe going to fit within, parents' values and expectations as well.
So you did just mention Allegheny and Washington counties. You want to speak more broadly about the service area of the Language and Behavior Center as a whole?
Yeah, absolutely. So the Language and Behavior Center was founded in Silver Spring, Maryland. So Montgomery County, Maryland was our first area of service. We now provide services in Maryland, kind of the DC and Maryland area, as well as Virginia. And then we also provide services in New England, so the surrounding Boston area, and Pennsylvania. So in Pennsylvania, we are in network in Allegheny and Washington counties. And so that's where we offer that applied behavior analysis service, as well as parent and school consult.
Well, that's awesome. And I'm already hearing such great things that I'm going to ask. You've mentioned two counties. Have you considered spreading across the state of Pennsylvania?
Yeah, absolutely. It's a question we get asked a lot. There's obviously a huge need for services for the children that we work with and the families that we support. We absolutely at TLBC we tend to focus on that organic growth and growing within each of our regions in a manner that is slow and sustainable, to make sure, the clients that we're currently servicing are really well staffed, they are well supported, the families are well supported. And so, and also that our employees are very well supported. So, slow and steady wins the race. We try to make sure that, the regions that we have started in, outside of that initial Maryland region, were started based on the interest of individual employees who are already associated with the organization. So, myself being having family in Pennsylvania and, wanting to be in this area, and we're not necessarily ventures of, oh, let's expand, let's take on more clients, but more of a right place, right time. And so that's kind of the focus that we try to continue throughout our practice.
Well, I love what you said about being able to properly support the children, the families, and the employees, because any one component of that doesn't work means it doesn't work for everyone. So when we talk about those employees, can you tell us a little bit about who actually provides the services through TLBC?
Yeah, so our team is made up of board certified behavior analysts who are the ones who oversee the teams. So they are the ones who do our initial assessments, ongoing supervision, parent training, school coordination for all of our kiddos that we serve. And then the direct services, so more of that day-to-day therapy services, are supported by behavior technicians and registered behavior technicians. We do ask them all to get that credential over time with us. And so those professionals are all guided with ongoing support and clinical training. And then in our other service areas, we also have speech language pathologists and occupational therapists who provide those individualized services as well.
So you don't provide those two services in Pennsylvania. Do you make referrals for those services? How does that work?
Yeah, absolutely. So, we do have those services in-house in our other regions. We do collaborate with them just on a clinical level of training and understanding some of those aspects of different disciplines. But for our Pennsylvania clients, we do coordinate a lot with local services who provide that support, and then coordinate with them on an ongoing basis. Because while ABA and behavior principles are fantastic, we're also not experts in speech, and we're not experts in occupational therapy or physical therapy. So we want to have that really multidisciplinary team and approach for each of the kiddos that we work with.
That's awesome. I love hearing about the team. So let's take a deeper dive then on how you do support the children and their families. What does that look like? How do you get involved?
Yeah, so we try to take a very comprehensive team approach. So as I mentioned, we work with all the different professionals that a child is seeing across their different environments. So an initial assessment starts with us, meeting and evaluating the child in their natural environment. So oftentimes we start with a parent interview in the home, discussing with the parent, what are your current concerns? What are your family's needs just as a family structure? What do you do on a day-to-day basis? What's important to your family? So we can really make sure that we are tailoring our approach to what's most acceptable for the family and going to fit best into their day-to-day, as well as an observation of the kiddo in their setting. What do they like to do? What are their strengths? What do they want support with? What are they needing support with? How do they interact with us as well as, an outside person coming into the home, and really starting to kind of build that rapport and see, what is going to work best within a treatment setting. And then we also observe them in any other environments they're in frequently. So whether that's a school setting, a daycare setting, a preschool, we want to see what things are looking like in that natural environment, what's working, what needs support, what can we learn from those other professionals. And then we typically do a community observation as well. So, how do we follow directions in the community? How do grocery trips go? Is there another community organization or activity that a child's involved in? Maybe they're involved in like a church group. How does that look? Maybe they're going to a social skills group already. What does that look like there? What's going well? What could we support in a one-on-one setting as well? We have those conversations at the get-go during the initial assessment, but then of course we want to maintain that open and ongoing conversation with all the caregivers. So from that initial assessment and treatment plan process, we develop this plan and these recommendations, but that doesn't mean that doesn't change over time. I always tell parents, this is a written document. We're going to sign it. We're going to submit it. We're going to make sure, it is what we want to start with, but it is a jumping off point and it can always be changed. It can always be adapted at any point in time. We want our families to get the most out of these services. And that means us being able to adapt and change as their lives adapt and change. So we want to make sure, that we're really addressing, the specific challenges and hurdles that they're seeing right then and kind of starting with that, prioritizing, what is most important to the family and the caregivers. We want to make sure that our strategies that we're offering are acceptable and appropriate for the family and caregivers, that it's realistic for them to implement. If we make one recommendation and we're like, yes, this sounds great, but then they're like, that's not realistic for me to do, we're really doing a disservice to the child. So there's many, many, many ways for us to work on, the same challenge can be worked on in many different ways. So maybe we try one approach, doesn't work, we can always shift. But again, having that open and ongoing conversation with the families to make sure we are adapting. Our goal is that if we do our job right, we put ourselves out of a job. So from the get-go, we're talking about, what can we do for you guys not to need us? What can we do where the professionals and caregivers and parents that are in a child's environment feel confident in implementing the skills that we're suggesting and developing with them and the strategies we're talking about as situations come up and as things progress, so that way they don't need our services anymore. Our services can then be discontinued. So really starting from the beginning with that as our goal and keeping that in mind throughout the process, and adapting if that goal seems out of reach at any point in time. It's like, how do we adapt and change to that? Like I said, we're not experts in every discipline. So bringing in, that coordination and collaboration with speech professionals, occupational therapists, physical therapists, the education team, to make sure, that everybody's on the same page and we're really considering all of those different factors and coordinating on an ongoing basis with that child's whole team. We're also a values-based organization, which goes along with a lot of that, making sure, that we're providing compassionate care to our families and understanding, like I said, there's lots of disciplines at play here. ABA is not their whole life, nor should it be. We want to make sure, that all aspects of that child's life are considered and valued as important. And also, being transparent with them of like, this is what we can support with, and this is what we need additional support from another professional on. And we also are an anti-ableist organization. So we do take an anti-ableist approach. We want to make sure, that we're not perpetuating an ableist narrative and programming in a way that we're really lifting up those strengths and focusing on, what is acceptable to the child and their own coping strategies. And so, our practices may look a little different from a traditional ABA approach, as, we're trying to make sure that we're focusing on that autonomy of our clients as well.
I love that it does sound like you really, those values in the organization and the support for everyone involved and including the whole team sounds really crucial and like you said, uplifting. So if we can turn a little bit, because one of the things you mentioned is supporting the kids in all of their settings. And you mentioned a whole lot of them, whether they be family, social, educational. But can you talk a little bit about what services may look like in a school setting?
Yeah, absolutely. And it's going to look different for every kiddo, right? So we're talking about individualized care here. So when we're talking about individualized care, our goal is not like, okay, we're going into a school, we're supporting them every day, all day at school. That's not our goal. Our goal is to evaluate first, see, what are the challenges right now? What's going well where we don't need support? Where is the need for support? And then evaluate what's going to be the best way to support. So an assessment is just that. It's an assessment. It doesn't mean that we're going to, say, okay, you get this many hours in school just because we did an assessment. It may be a recommendation to support the natural supports more. So, the teachers, paraprofessionals, somebody who's already in that child's environment. Is it beneficial to add somebody additional into that setting? Sometimes a lot of people is a lot of people. And so, what is going to be most appropriate for that kiddo? And then always, reevaluating that on an ongoing basis. Maybe at that time, yes, it's super appropriate for us to have, a behavioral health technician, an RBT there. For some extra support. Maybe we're seeing, behaviors that are very frequent and really needing that ongoing support by an extra professional. But maybe in 2 months, that person's not really needed anymore. Okay, great. That's, like I said, best case scenario is we don't need that extra person there anymore. And the natural supports are able to support with maybe some just consultation by the BCBA or the supervisor on the team. And we're assessing on an ongoing basis too, right? So we want to make sure those recommendations are flexible. And same thing, if a teacher's like, I think we've got this, that's, we want to instill that confidence that, we don't need that extra person there.
Right. Well, and I think it sounds like you're supporting, as you refer to the natural supports, the caregivers and the teachers they're going to encounter. You're supporting the other supporters.
Yeah.
But I think ultimately that goes back to supporting the individual, the child as well. So, and you repeated it, but I think it bears repeating once again that the idea that you're doing so well, you're putting yourself out of a job. I love that it's not about the bottom line. It's about the progress.
Yes, absolutely.
Something that we hadn't talked about before, but I'm just considering that perhaps it might be important to some of our audience members. Can you talk a little bit about what your services might look like with teenagers?
Yeah. Same thing. We're talking about that like individualized support. sometimes teenagers don't want an extra person hanging out with them. And that's okay. That's absolutely okay. We can definitely provide, a consultative basis support. And so maybe what's best is for us to support the parent in some strategies of, implementing some motivational techniques or implementing a reward system. We can definitely support the parents with that as well. Sometimes, we get to a point where we always want our kiddos to be involved in their treatment planning. And so if they're at a point where they're like, I think I'm okay, I want to hang out with, my friends and stuff, that's great. We want to encourage that.
Right.
And especially if we have a client who's like voicing anything like that, that's our first sign to be like, all right, great. This is the direction we're moving in. If we had, a kiddo we were starting with that was a little bit older as well, same thing, we'd look at like, where is the need? Is there a need for that more intensive support? Would it be beneficial to have a less intensive support and more of a consultative nature, but really individualizing it for that kiddo? And often, especially with our teenagers, always with our little kids as well. But especially with teenagers, we may support, talking about what do they want to get out of services as well. And
Right.
What is most appropriate for them, and kind of what are they comfortable with. And so that's a really big part of that as well when we kind of get to that older age range.
And I think that kind of goes back to what you mentioned about the anti-ableist approach, that when you're getting the input from the individual themselves and they're saying, no, I'm good like this.
Yeah.
That we're accepting that and supporting them where they are. So I think that becomes really crucial. I know as parents, sometimes we lose sight of letting them be who they are because we're so focused on getting them up to speed with everyone else. And it sounds like if they're okay where they are, that's where you support them.
Yeah, absolutely. And getting that input of, and balancing it, right, with like the parent expectations of, okay, what is an expectation? What is, a choice for us to make of like, this is what I want, this is what's more important to me. And oftentimes that does, involve like values-based questions and discussions with our families of, we really, really want to support the kiddo and their individuality. And that is a conversation that we've been having so much as clinicians at TLBC over the last few years, is how do we really lift that up? How do we have those conversations with parents where sometimes it's a little uncomfortable? It's, they're bringing us in to support with certain things. And how do we have those conversations of like, where are we going to support? Where are we going to make adjustments? Where are we going to provide teaching opportunities? And then, how do we also at the same time lift up the individual client to be who they want to be and use the coping strategies that they want to use? That's
so important. And I think it's unfortunate that in a lot of situations, folks lose sight of that.
Yeah.
So if we can turn a little bit, you've talked about these great services that you provide in the areas that you cover, but can you tell me, from where do you get your clients? How are people referred to the Language and Behavior Center?
Yeah, absolutely. All different ways, really. So, one of the unique things about Pennsylvania is that oftentimes the counties are really involved within, coordination of services. So whether that is supports coordinators from within the county, or it's the behavioral health components of, the county organizations and structure, we do a lot of coordination with those providers and those supports. They're saying, okay, we have kiddos who have a need in this area. Are there any providers who are available? And then having a discussion with the families directly of, are we an appropriate provider for you? Are we going to fit your family's needs? Are we going to be on the same page with, how we program things like that? And just making sure, that that's an appropriate fit. And then again, there are supports coordinators in a lot of areas. They are out of different organizations. And so especially as we get familiar with some of those supports coordinators, they kind of have like our programming in mind, or they've worked with us before and they understand, kind of our values-based approach and how we work with families. And so maybe if they get a kiddo, on their caseload and they're like, oh, I think this might be a good fit, they might reach out to us directly. We do get direct inquiries from families as well. So, if you search behavior services in Pittsburgh, I'm sure we come up somewhere on Google as well. So sometimes families will reach out directly to us, or their PCPs will mention, that we provide services, or Facebook groups will talk about, the services we provide. And so we do get some direct inquiries from families. I do love being able to, even if we get a referral from another source, being able to directly connect with those families and kind of talk through the process and answer questions. Sometimes schools refer families to us as well, of saying, here's the contact information. And then again, we touch base with the families and kind of go from there.
So it sounds like your reputation precedes you. People get to know you and know about these wonderful supports. So that's awesome. I'm going to turn a little bit now. Earlier, you mentioned that in Pennsylvania, your services fall under Intensive Behavioral Health Services, IBHS.
Yes.
So does that mean it's covered by insurance?
Yes. So as long as a child meets those requirements for IBHS services in Pennsylvania, which does involve, that behavioral health diagnosis, and then, we go through the assessment process and everything. But we, of course, first check with insurance to make sure that that is going to be a covered benefit, that they do meet those requirements, that those diagnostic criteria are met. They have the correct, documents in place to be able to commence services. And we do coordinate then with both primary and secondary insurances. So a lot of families in Pennsylvania will qualify for secondary insurance for, ongoing medical needs. And so we coordinate with both of those insurances. So we are in network with most major commercial insurances, especially in the area. And then we do accept secondary insurance, which routes through the county for Allegheny and Washington counties.
And you, by secondary insurance, you're referring to Medicaid, correct?
Yeah, so Medicaid and medical assistance. There are, different physical plans for medical assistance and Medicaid in Pennsylvania, but we are in network with all of the medical assistance and Medicaid plans.
Okay, good to know. So I guess probably dictated a little bit by that, but as we're talking about this, kind of depends how long you've been around, what terminology you've heard. But I can imagine for some of our folks are saying, gosh, this sounds an awful lot like what I used to hear was called wraparound.
Yes.
Is that the same thing?
Yeah, so a couple of years ago, Pennsylvania shifted everything that was previously wraparound BHRS to this new umbrella of IBHS services, focusing on comprehensive and natural supports in different environments, as well as like fading out those services once they're no longer appropriate. So we are serviced under that same, umbrella now of IBHS that was, previously BHRS and wraparound, so to speak.
Thank you for clarifying that, because I think there's so much terminology out there, and trying to determine what are we actually capturing. And I used to hear this, so I think it's important to explain that we're no longer using that term, but it's the same type of thing. It sounds like perhaps a little more intense and all-encompassing, and I like that approach.
Yeah, absolutely.
I'm just going to say that this is one of those where we've had so much to discuss that, you and I talked about this in advance. We have to fit so much information in such a short period of time that sometimes we almost rush it to try to get through that. There is so much to it. One thing I always want to make sure that I want to be able to share contact information, because I think it's important, whether you have a question now or you think about it in the future, you need to be able to get in touch with Elizabeth or the Language and Behavior Center if this is something that you need to pursue. So I'm just sharing, and this is every month I struggle with my own technological limits. So there we go. You should be seeing the contact information for the Language and Behavior Center. And this is the Pennsylvania contact. You will reach Elizabeth through info@tlbcpen.com, or her phone number is on the screen also, 304-919-2843. But again, this is just contact information directly for Elizabeth in Pennsylvania. And as she mentioned, the Language and Behavior Center does serve broader areas. So if you're hearing about this and you're wondering if there's someone, you can obviously go to the website. And I don't have it on here. Is that TLBC.com? I know I've been to the website.
Yeah, it's www.tl-bc.com is our main website. I will say as well, while we are in different regions, the directors for the different regions coordinate on a daily basis. And so it's also something where, if you're unsure if we provide services in a certain area, I'm more than happy also to kind of direct you in the right place. As well as I know you mentioned that just kind of the shifts in terminology and
Right.
kind of everything that goes into these services and the process in Pennsylvania. I'm always happy to kind of talk through that with families of just like what the process looks like, discuss kind of their individualized needs and what they're looking for, where they're at in the process. So I also always encourage families to also just use us as a resource for kind of navigating that. And sometimes it's very confusing to come out of an appointment with, this big long write-up and recommendations and not really know where to go from there. So I'm always happy to, kind of provide some of that information and provide support to families as well. And even if it's not us, but steer them in the right direction of who can best support at the time.
That's awesome. And that's why I point back to the story that I told about when we first met, because, listening to you, I'm hoping that our audience realizes that you're really dedicated to this and you're passionate about it. So doing the right thing for the kids is far more important than who is doing what. And I really appreciate that about you. So thank you for that. So I really want to thank everyone for joining us today, especially thank Elizabeth for sharing all this great information. As I said, I really appreciate your passion for it. And see, we zipped through faster than anticipated just because we knew there was so much.
Yes, absolutely.
Are there any final comments that you think would be beneficial to anybody that may be seeking services?
Yeah, I think, the biggest thing, like I've mentioned a couple of times, is that that individualized care and that individualized support for both the child as well as the family is so important to kind of prioritize. And so for us, we always take the approach of having those ongoing discussions and starting that from the very beginning of like, this is our emphasis. We certainly have some information as well about that on our website, just, kind of the approach we take, some of the action items we've taken as an organization, just to make sure that that's something that we're always doing across all of our regions, and really honing back in on that, as well as kind of recentering ourselves often to our values. On an employee standpoint, we have those conversations frequently with our employees at every different level, just proactively to make sure we're always kind of recentering back to, this is our mission, this is our focus. How are we seeing this throughout the company, and how do we continue it? I'm always, like you mentioned, I am very passionate about kind of those efforts, both with our clients as well as with our employees. And my door is always open as well to kind of have those discussions, whether it's with different professionals in the field, or with families, or with people who are looking to kind of learn more about the field.
That's awesome. And I know that when you say that, you mean it.
I truly do.
Her door is always open to her very cold office. That's a whole
It is
level of
very
discussion.
cold.
But I thank you for that and for sharing, because knowing that it is such a values-based organization, I think families can feel comfortable in realizing that the service will really be focused on what's best for their loved one and how best that can be supported to their individual goals. So I thank you for sharing all of that. And I do want to invite anyone, if they have questions, by all means, you can email me or reach out directly to Elizabeth. And again, if you're looking for an additional topic that you'd like to discuss in the future, I'm happy to take those suggestions. Our next session will be Wednesday, November 22nd, 2023, which is the day before Thanksgiving, but I promise to come with good content and make your time worthwhile. And for anybody that's busy preparing their turkey that day, that's okay. The sessions will be recorded and posted to the website. So thank you again to everyone for joining us. Thank you, Elizabeth, for all that you've shared. And I'm hopeful to be able to send a lot of folks in your direction.
Sounds great. Thank you so much.
All right, take care.
You too.